The mandates, I mean, there were a lot of problems with it. The question is, does this bill go far enough in repealing it and replacing it? There are some similarities. Now, one of my favorite experts on this is Dr. Elaina George. She's an ear, nose, and throat doctor. I've had her on before discussing this issue. And Dr. George, welcome back to the show.
Thank you for having me.
No, thank you for making time for us today. I know it was last minute, but when I saw that they had rolled this thing out, I couldn't think of anyone better to give me their opinion on it. What do you think of this replacement bill?
From what I understand of it, it's a first step. I mean, that's what Secretary Price mentioned. The thing that stands out to me that's good is that the mandate is gone. And that releases people from having to buy something that they can't afford, and that tax to them is over. That, to me, is the biggest plus in it. You know, the fact that they're still allowing people to keep their children on their insurance at age 26, it's a problem with cost. I mean, imagine you having all these young, healthy people who are, once they're out of the pool, the risk pool, it gets skewed towards older people with more problems, more medical problems. And so that's not going to drive the cost of premiums down, unfortunately. I would have liked to have seen at least a compromise. Lower the age, maybe to 23, so you actually have more young, healthy people enter the insurance market. We have tax credits now instead of subsidies, and I think, you know, for better or for worse, you know, there's still going to be people who can't afford to carry health insurance, just like they couldn't under the Affordable Care Act. But I think it's going to be made into a political football where it is going to be said that this bill, leaves people out in the cold. But it's kind of disingenuous because even though people have health insurance, a lot of them can't afford to use it. So for all intents and purposes, nothing's changed.
You know, that's a great point. I want to play something that Senator Rand Paul said about that very subject this morning. Listen.
And people have to realize, they say, oh, well, you know, all over the liberal press, they're saying, oh, who's going to lose their insurance? They have to realize that people who have insurance can't use it now because it's too expensive on premiums, but way too expensive on deductibles. In a real marketplace, the higher your deductible, the lower your premium. We completely have broken the insurance marketplace, but I think Obamacare Light doesn't fix it, and I think it's a real mistake to go for this. But the negotiation will be conservatives saying, hey, we're not going to take Obamacare Light.
So he has the same concern you just mentioned. I mean, a lot of people have health insurance right now, but
right.
if your premium is $600 a month and your deductible is $6,000, you've got to spend $12,000 before your insurance is helping you any.
You're absolutely right. So you're carrying a piece of plastic that you can't use,
right,
except to say, hey, I'm covered, so I'm not going to be fined. So it's not real, and it's become this social justice warrior disaster where if you want to make changes, you're called names. If you stick your head up and say it's not working, but I'm here to tell you as a practicing physician, not an academician, but a doctor who sees patients every single day, it's not working. People aren't going for labs. They're not having procedures that they need done. They're not coming to the doctor in a timely fashion, and they are still using the emergency rooms. So it's still just as expensive as it was before, but the government and the insurance companies have gotten a carve-out. I mean, basically, they're just taking the money. The middleman has become more powerful, and the doctor and the patient are still in a position where they're on the outside looking in. And, you know, some of the tenets of allowing the older people in the insurance pool to pay 5 times more than the younger people just shifts the cost to a different cohort. It was the young people paying most of it. Now it's going to be the older people paying most of it. But we need to have the doctors and patients in the room when this thing is being negotiated. The major mistake has not been corrected. When the Affordable Care Act was passed, it was the insurance companies, the hospitals, the big pharma, the unions, everybody but the doctor and the patient was in the room, and they're doing the same thing. That's a problem.
That is a problem, and I'm hopeful that the version we're seeing right now is not the finished product. I'm hoping that by the time it works its way through reconciliation, if it gets that far, that they've corrected some of these problems. I was told earlier that there was a 2015 version of this that passed the House and the Senate, and of course was vetoed by the president. that was a more workable plan. Is that your understanding of it?
I never saw it.
Okay.
But there was like a lot of bills that passed. But, if I were in the room here helping to craft this, I would do three things. One was get rid of the mandate, which is awesome. Two, I would allow health savings accounts to be used for anything medical that the patient wanted to use it for. Right now, the insurance companies rule, and if they don't cover it, you cannot use your health savings account for it.
Right.
So they basically have your money captive. That's completely ridiculous. And the third and most important thing is price transparency. People need to know what something costs before they roll up into an ER, a hospital, a doctor's office, because when patients are consumers, they are going to be the best stewards of their money, and they will cause the market to drive towards more cost-effective, better customer service, more innovative care. And isn't that what everybody really wants, if they're really honest?
Sure they do. And Dr. Paul discussed the same problems with this earlier. So all we can hope for is that at some point they wake up and they include some of that in there, because this particular bill, I don't know if you heard this or not, it gets rid of most of the taxes that Obamacare started, except for that Cadillac tax, which it pushes down the road to 2025, I think, and then it kicks in when they start taxing your health care plan as income. Well,
they're taxing the best health care plans. So they're going to drive everybody into HMOs, to Medicaid for all and Medicare for all, because most people will be priced out of the good insurance plans. Mm-hmm. That's the game all along. It's to make Medicaid and Medicare for all, where the insurance companies are the administrators, such as Medicare Advantage, and people have very little choice, but they're going to pay for the privilege of having nothing. That's what they want. Why all the carve-offs and give-backs and price controls that benefit the status quo remain in effect. And I honestly do believe that we do have power. I'm about to call my congressman, my senator, and give them a piece of my mind about how I refuse to vote for them if they don't fix this. And if everybody in this country did that, that would be the best way to get them, put a fire under these guys so they can stop playing the same game, telling us what they think we want to hear, and pulling the rug at the last moment. This is our chance now to really make a change.
Excellent point. Dr. Elaina George, thank you so much. I'll remind people of your book, Big Medicine. They can read more about that on your webpage there at drelainageorge.com. And thank you for making yourself available on short notice.
Thank you for asking me. Have a great day.
Yeah, you too. Thank you. Great job. And thank you for explaining that in the terms that you did. She is a working ear, nose, and throat specialist. She lives down near Atlanta, Georgia. And she understands how the system works and why Obamacare was failing. And when you hear Rand Paul say, this is Obamacare light, we don't want this. We have to stop health care costs from spiraling out of control. You need to pay attention when you have two different physicians telling you the exact same thing. I'm a little surprised that Tom Price hasn't been a little more worried about some of this than he is. This is another